A major alert from doctors at one of America's leading medical schools. A new report from Johns Hopkins says more than 4,000 times a year, surgeons are making mistakes in the operating room that should never happen and can be stopped now. ABC's chief medical editor, Dr. Richard Besser, with advice for everyone tonight.
A surgical clamp left inside an abdomen, a scissor blade left near a pelvis, even this one, an 18-inch retractor left behind. And surgical mistakes like the one that happened to Lonnie Sowell. They operated on the wrong knee.
I was helpless.
It happens a lot more than you might think.
What we found is that about 40 times per week in the U.S., patients have a sponge or a towel left. 20 times a week, we operate on the wrong side of the body or the wrong part of the body, and 20 times we do the wrong operation.
Dr. Jeffrey Port of New York Presbyterian Hospital showed me what's supposed to happen before surgery even starts.
Make a mark with our initials on the side of the surgery.
The surgeon initials the correct limb. Once inside the OR, everything stops, and they hold up a checklist.
What is the procedure? Does it match the consent?
Nurses should count the instruments and gauze sponges before and after surgery. And some hospitals use a new technology that Dr. Port pioneered. A tiny tracking chip attached to each piece of gauze.
Are surgeons taking this seriously?
Very seriously.
And Rich Besser is here now. So you walk into the hospital, what's the first thing you ask? What's the first thing you do?
Well, you want to make sure that your hospital is using this checklist, using this system. Surgeons call these type of errors never events because they are all totally preventable. And you want to make sure that your doctor is following those rules.
But I was asking you, what about taking your own magic marker, and whether it's you or whether it's someone you're advocating for, go ahead and mark it yourself.
Yeah, I mean, do that yourself. They should be doing that too. And you want to make sure before you're wheeled into that operating room that they know what they're doing and what part of their body they're doing it on.
And if you haven't seen a mark being made,
don't go into that operating room.
Take action.
Exactly.